Hello everyone, I'm Dr. Tarun Jayakumar, consultant orthopedic trauma and robotic joint replacement surgeon. Today we'll be talking about a very common question asked by all orthopedic patients. When should we do an implant removal after an orthopedic surgery for fractures? So let us say you had a fracture. So the important question is you have undergone a surgery, you have been fixed with a particular orthopedic implant, and your main concern is whether or not it should be removed after the surgery. So that entirely depends upon the indication for which your surgery is done and what type of implants were used. Firstly, let's come to the type of common implants that we use in orthopedic surgeries. The first common implants are K wires. K wires are wires that we put from outside your skin, which go in and fix the fracture in their correct position. So K wires usually need a healing time of about 4 to 6 weeks. So once your orthopedic surgeon confirms that your fracture has been united by looking at x-rays and clinical examination, the K wires can be removed usually after 4 to 6 weeks. This is a OPD procedure, meaning it does not need to be done with an admission or under anesthesia. It can be removed in the OPD itself. The next most common type of implants that orthopedic surgeons use are plates and screws. So plates and screws ideally can also be removed once the fracture unites, and the minimum time needed for the plate and screws to be removed is 12 to 18 months. So only after a period of 12 to 18 months, once the fracture has been confirmed to be united on x-rays and clinical examination, it can be removed. The other common orthopedic implant is intramedullary nails. Again, nails are done for fracture fixations in long bones, and these also follow the same timeline as that of plate and screws, and it can be removed after a minimum duration of 12 to 18 months post fixation once the fracture has been confirmed to be united. So now let us take a look at external fixators or Ilizarov ring fixators. So the fixators per se are used for a variety of indications. So the ring fixators in general have to be kept in place until the entire fracture has united. This can take a long duration, ranging from 6 months to even up to 2 to 3 years, depending upon the fracture and the situation for which it was used. The external fixator is usually a temporary fixator. We generally use external fixators in today's practice mainly for open fractures, meaning the wound is exposed and the fracture itself is exposed. In such scenarios, we use external fixators, and once the wound has healed, the external fixator is removed and we go for a definitive fixation. So the external fixator time is usually again 4 to 6 weeks. The next question is, why do you need to remove implants? Is it compulsory to remove orthopedic implants? Any implant that is placed from the outside and is visible externally definitively has to be removed. The implants which are placed under your skin, such as nails, plates, and screws, can be left inside your body throughout your entire life. So then why do you need to remove implants? The main common reason that we remove implants in orthopedic surgery are: number one, infection. So if there is an infection or your implant or your orthopedic surgery has got infected, definitely your implants have to come out. And here again, it does not have to follow the usual timeline, and we do not have to wait for the entire bone to unite, because in an infection scenario, the implants definitely have to come out. The second most common reason that you have to remove implants is local irritation. So what happens is, once the fracture is united, or if the implant and the screws start backing out, then it is an important reason for us to go ahead and remove the implant so that it doesn't cause further soft tissue damage and irritation to you. Another reason to remove implants in orthopedic surgery is if the screws themselves are within the joint. If on a radiograph we find that the screws that were placed during the time of the initial surgery are located within the joint, this can cause early wear and tear and osteoarthritis of the joint, which is an absolute indication for implant removal. Another scenario that implants definitively have to be removed are in growing children or at an adolescent age where the growth is still available and the implant has a tendency to hamper the growth of the bone. Then in such a scenario, the implant definitively has to come out. Coming to the next important question, are there any complications associated with implant removal? Yes, like any surgery, implant removal itself is a major surgical procedure. And in fact, surgeons would argue and say that implant removal is usually much harder than placing the implants inside themselves. Because once the bone has united, it is very difficult for the bone plates and screws to be removed because there is usually a bony overgrowth that happens over the plates and screws. If your implant is in your body for a longer duration, the more likely chance that it will not come out. The next most common complication following an implant removal is refracture. Suppose your bone has united thoroughly after the first fracture fixation and you have come again for implant removal surgery, and your surgeon had a very difficult time removing all the implants, the plates and the screws. There is always that chance that your bone can refracture again after the implant removal surgery. This is also something that patients should be aware of. Finally, the clinical recommendations that we have are every patient is different, every fracture is different, and every scenario is different. So always consult with your orthopedic surgeon, ask them your common queries and doubts that you have, and your orthopedic surgeon is always the best judge of whether an implant should be left inside or if it is safe enough for it to come out without a complication. Thank you.